All right. So welcome to NCLEX Jeopardy Thursdays. I'm gonna give y'all some time to get into the room while I bring up my computer. How are you guys doing this wonderful last day of March, right before April Fool's Day? Oh, I can't wait to tell you what we got planned for tomorrow / this weekend. Okay. But like I said, I'm gonna give y'all some time to get in. Hello. As you guys are coming in, if it is your first time, if you are a first timer with us, please let me know below. Put in the comments that is your first time playing NCLEX Jeopardy. If you are a repeat offender, what's up, boo? Welcome back. Let me know that you're coming back for second, third, whatever many times, to make sure you are getting yourself ready and prepped for that NCLEX PN or RN. Let me say that now. This NCLEX Jeopardy review is for PN, practical nursing students, and registered nursing students. Why? Because the questions are going to be the same. Very similar, whatever you want to call it. Okay? This hypertension is hypertension, period. Okay, so let me go ahead and bring up today's review. It is going to be a good one. All right, let me see what you guys are saying. Doing this for fun. You can also be doing this for fun because listen, ain't nothing like a good refresher, especially while you're especially if you've been in one specialty and you're moving to another specialty, or hey, you're bored and you just want to refresh your memory. Like I said, I've been a nurse for 8 years, and even now, I make these. I make these, and sometimes I'm like, how did I get that wrong? But hey, you will never remember everything. You will never get every question right. So get that out of your minds. If you think that's gonna be your life, because I promise it won't. I promise, not in nursing school, you're gonna get at least one thing wrong, and it's gonna hurt. But I promise you're gonna get over it. I promise, because we're gonna understand why we got it wrong, so that next time we get it again, we don't get it wrong. Okay, that's the whole point. So I don't want y'all beating yourselves up. Okay. All right. So I've brought up our game for today. Let me load through. Hello. All my first timers. Hello, guys. Welcome to NCLEX Jeopardy. All right. So just in case you, like I said, it's your first time, so you really don't know. I'm going to show you guys what we see. Don't worry about my rose. Actually, it's Oze Alda, because literally the balloons fell, but we'll talk about it later. All right, so let's show you our NCLEX Jeopardy. It's literally blue screen. You know, we have 5 categories and 5 questions per category. So I'm about to show you. I'm about to show you now. One sec. Boop. All right, so that's what you're going to see. All right, dosage calculations, pediatrics, mental health, and fundamentals, and adult health / med surge. All right, so this is just like Jeopardy. All right, this is our NCLEX review, like I said, for practical nursing and registered nursing students. I just put it in an NCLEX, well not NCLEX, a Jeopardy form, so that it's more fun, so you have more fun, be more motivated to actually study, learn, and review. If for some reason you want to catch this replay, you can only do so in the Study Bar community, which is still open for enrollment for $29.99 a month. You have about 15 other replays, so you got a good 15 hours plus, honestly, of pure NCLEX review, NCLEX Jeopardy review replays in the vault right now. You get instant access as soon as you join and enroll. So it's none of the content is drip. You get it all. Well, you pay for it, you get it. Okay. All right. So like I said, once again, our categories: dosage calculations, pediatrics, mental health, fundamentals, and adult health. One other thing, even though we are playing on Instagram Live and we're doing it verbally, after our hour is up, you guys can actually play this game for free, this actual Jeopardy game for free if you download the mobile app, the Nurse Sam. Now, a lot of people have been asking which app is which. All right, there's going to be 2 apps that you see if you type in Nurse Sam, because she has her own platform. But you can see the Nurse Sam app, white background, literally Nurse Sam words, boop, white background, Black and Gold Nurse Sam. That is going to be the app that you want to download to play NCLEX Jeopardy. Okay, once you download that app, it's for free. Okay, once you download that app, available for iOS and Android, you're going to go ahead and go to NCLEX Prep. And when you click NCLEX Prep in that app, you're going to see Play NCLEX Jeopardy, the mobile version. All right, you're going to click that, and there you go. You have the mobile version of NCLEX Jeopardy. Right now, this current second, the questions are the ones from last week. So after we get finished doing our review, because of course we play for prizes. After we're finished with our review, I'm going to update it so you guys get these questions. All right. So just in case that went over your head, every week you guys get 25 new NCLEX questions, RNPN, both of them can take at the same time, for your review. Okay. Wait 1 second. Yes, that is my promise to you guys. Every week, 25 brand new NCLEX Jeopardy questions for you guys to review anytime, anywhere, especially if you have that app, for free. Okay? Can't beat that with a stick. Let me look at what you guys are saying. All right, let's go ahead. Okay, and a couple things. Quick house rules. So because this is NCLEX Jeopardy, if you guys have never played or watched Jeopardy, you have to answer what is. Okay, so I'm going to read the question. I'm going to read the answer choices. It is multiple choice, answer choice. There's no select all that apply. So it's going to be 1, 2, 3, or 4. There's going to be the answer choices. So in order for you to answer correctly and actually, have a chance of winning, you have to say what is. My advice and my tip to you is that you go ahead and type what is in the comment right now and just copy and paste that thing. Just what is, and just copy and paste it so that when you actually hear the answer and hear all the answer choices, once you figure out or decide on the correct answer that you think is the correct answer, all you got to do is press 1, 2, 3, or 4 in addition to the what is that you already copy and pasted. And that shaves a few seconds so you can have more of a chance of getting it first and being first on my screen. Okay, once again, you have to be first on my screen. This is Instagram. Connectivity is a little janky. Okay, so what you see on your screen may not be what's on mine because of the lagging. So I think that's it for the house rules. If y'all have any questions, let me know in the comments below. If you guys don't have any questions, we can go ahead and get started. Somebody go ahead and pick a category, and then I will pick the specific question. So once again, the categories are dosage calculations, pediatrics, mental health, fundamentals, and adult health. So which one should we start with first? You guys let me know. Let me know. What do you guys, okay, somebody said mental health. That's going to be what we, somebody's adult health, but mental health was first. All right. Let me go ahead and do that. 1 second. Let me bring up our questions. All right, so we're going to do mental health. Let's do mental health for 300 points. Sure, let's do mental health for 300 points. All right, once again, I'm going to read the question, the answer choices, and you guys are going to say what is and then whatever the answer is. All right, so first question. A client diagnosed with depression is scheduled to receive 3 sessions of electroconvulsive therapy. The nurse should tell the client that he or she will likely start to see improvement in approximately what time frame? Is it 1 week after the 3rd treatment session? 2, 3 weeks after the treatment sessions begin? 3, midway between the 2nd and 3rd treatment session? Or 4, 8 weeks after the treatment sessions are completed? All right, what is going to be our answer? Don't forget to say what is and then whatever answer you choose. I'm going to run that back, okay? A client diagnosed with depression is scheduled to receive 3 sessions of electroconvulsive therapy. The nurse should tell the client that he or she will likely start to see improvement in approximately what time frame? Is it 1 week after the 3rd treatment session? 2, 3 weeks after the treatment sessions begin? 3, midway between the 2nd and 3rd treatment session? Or 4, 8 weeks after the treatment sessions are completed? What is going to be our answer? All right, so let me go ahead and scroll to the top. Give you guys a couple more seconds to get your answers in. Like I said, once again, for a reminder, even though we are playing for prizes, we are obviously playing for comprehension. Okay, that's the main goal. That you're really the winner if you get the answer correct. It doesn't even matter if you get it first or not. For this specific game, we're playing for incentive. So being first obviously matters for this game, but obviously on the NCLEX in the real world, it does not matter if you're first, if you're second, as long as you get that answer correct. That's all we care about. Okay, so don't let a fun, friendly game get you guys down. Okay, especially because I do these literally every Thursday at 7 p.m. Eastern Standard Time. So if you don't get it first this time, if you don't win this time, just come back next week. Just come back next week. All right, so that answer for this question is going to be, what is 1 week after the 3rd treatment session? 1 week after the 3rd treatment session. So that is number 1. The answer is, what is 1? Okay, let's see who got that right first. Let me look. Scroll to the top. Laura Allen, hey boo. All right, Laura Allen, she's like a veteran, just in case y'all didn't know. All right, Laura Allen, you are on the scoreboard with 300 points. Great job, love. All right. Let's see who else got what is 1. You may not, like I said, you may not have gotten it first, but let's see if you get it correct, so that if this was an NCLEX, you'd be golden. Okay, so let's look and see. Tucha, 83, great job. A lot of people chose what is 4, but let's go ahead and go over it. So it looks like only Laura Allen and Tucha got it right. So congratulations to you guys. Y'all would have got it right on the NCLEX. If you guys, everybody else, that's okay. Let's go over the rationale now to figure out where we went wrong, so that next time if we see this again, we'll be a little bit more refreshed on the information, okay? So once again, the answer is, what is 1? All right, the rationale says, psychiatrists generally prescribe electroconvulsive therapy, or ECT therapy, or ECT, treatments 3 times a week, with an average series including 8 to 12 treatments. After 3 sessions of ECT, the client should start to demonstrate improvement in 1 week. That means all the rest of the options are incorrect. So once again, the answer is 1. You should start to feel improvement, or the patient should start to feel improvement 1 week after the 3rd session. All right. Now, remember, there's an average series of 8 to 12 treatments. And after the 3rd, or a week after the 3rd one, is when they'll start to feel improvement. Okay, so great job. I think everyone that chose like number 4, that 8 weeks, I think maybe you guys were kind of taking that 8 weeks and mixing up with the fact that there's 8 to 12 treatments. But now you know, because it's Sam Super Show, whatever. Yep. All right, so let's go ahead and go to our next question. Hey, boo. All right, next question. Somebody said adult health, so let's go with adult health, and let's go for 400. Adult health for 400. All right, let's go ahead. Now, quick thing, make sure you guys are tagging your classmates, anybody else that you know that is either actively in nursing school or actively preparing to take their NCLEX. This is going to help not only with just NCLEX review, but it's going to help you with your exams throughout nursing school. So definitely tag whoever needs to be tagged so they can get in on this free review, okay? All right, so let me go ahead and get this next question up. Give me 2 seconds. All right. Here we go. Okay, let's go. All right, question reads, this is Adult Health 400. The question reads, a client with diabetes mellitus has a blood glucose level of 50 milligrams per deciliter and reports feeling hungry and shaky. Which should the nurse provide the client? 1, 3 ounces of 2% milk. 2, 4 ounces of apple juice. 3, 2 ounces of orange juice. Or 4, a teaspoon of granulated sugar. What should the nurse provide the client? Once again, a client has diabetes mellitus and has a blood glucose level of 50 milligrams per deciliter. It reports feeling hungry and shaky. Which should the nurse provide the client? 1, 3 ounces of 2% milk. 2, 4 ounces of apple juice. 3, 2 ounces of orange juice. Or 4, a teaspoon of granulated sugar. Just a spoonful of sugar makes the medicine go down. Medicine go down. Medicine go down. All right, let's look and see what that answer is. I would have got this wrong and I would have been really pissed. The answer is actually what is 2. 4 ounces of, okay, I see why. 4 ounces of apple juice. I know y'all that probably said 3. All I saw was OJ and I was like, that one. But it's actually number 2, 4 ounces of apple juice. Let's look and see who got that right. Because that totally went over my, see, this is what I mean by it's always, you can always come in on NCLEX Jeopardy because yes, I know. Because the refresher is to die for, okay? Because like I said, I got this wrong, period. I'm just let y'all know I got this wrong. I said number 3, but the answer is 2, 4 ounces of apple juice, and I'm going to explain why. Let me just see who got it first, who wasn't tricked by the question, because I was tricked. Mary SWBC. Hey, boo. Congratulations. You were not got by this question because your girl was. Okay. Mary SWBC, congratulations. You're on the scoreboard and in the lead with 400 points. Laura Allen, you are right behind her with that 300. All right. So let me see who else didn't get got and said the correct answer, which is what is 2. Mary was first. Who else? Sue X4, great job. We didn't get got. NC Pink Rose, great job. I know, Laura. I know. Right, listening to the OJ option. Let me look at, okay, so those are the only people that got the correct answer, but that's okay. Let's go over why it was the 4 ounces of apple juice. Okay, so first things first, quick question. That blood glucose level of 50 milligrams per deciliter. What is that? What would that be? What kind of condition is that patient in? What kind of a state? 50 milligrams, is that normal? Thank you, Unknown Beauty. You know what I was trying to say. Yeah, it is hypoglycemic, okay? That is a hypoglycemic level that is below the normal, all right? 50 milligrams per deciliter, that patient is definitely hypoglycemic, okay? Great job. Now, so you also knew that because the patient was feeling hungry and shaky, Okay, remember, those are going to be your symptoms of hypoglycemia. Hungry, irritable, shaky. Okay, just think about someone who's hangry. Kind of, those are going to be the same kind of symptoms of someone with hypoglycemia. Just add some shakiness, and if it's definitely too low, coma and or death can occur. Okay, so our goal is to very quickly raise that blood glucose level to normal, or just raise it above 50, period. Okay, so once again, that client is exhibiting symptoms of a mild hypoglycemia. So the nurse should provide the client with how many grams of simple carbohydrates? Let me see if y'all know this. Do you guys remember how many grams? It's like a standard number of grams. Whenever somebody has hypoglycemia, you should give them this many grams of simple carbohydrates in whatever form, but 15 grams. Oh shit, I just said it. Literally just said it. Yes, 15 grams. But y'all, I see 2020 DW and Chasing Nurse. Y'all got it before I pretty much spoiled it. So great job. I see you, NC Pink Rose. Yes, it was 15 grams of a simple carbohydrate. That's going to quickly increase the blood glucose level. So remember, 4 ounces of apple juice. That's 1/2 a cup. That's equivalent to 15 grams of carbohydrate. All right, that 2 ounces of orange juice is actually below that 15 grams that we would actually need. It'd probably be about, okay, 4 ounces is 15 grams, then 2 ounces, 7.5 maybe. I don't know. But it's going to be below that 15 grams that's needed to quickly raise that blood glucose. So that's why number 3 wasn't the correct answer. It wasn't because it was, orange juice, because we all know that OJ is kind of like the magic word. That's the magic phrase, the magic juice that you see whenever somebody has hypoglycemia, is diabetic, and is exhibiting symptoms of hypoglycemia. You want to give them, the quickest thing that they say is orange juice, but it's not the orange juice that's the important part. Even though that is important, that it's a simple carbohydrate, the important part is that you give them enough so that it can actually raise the blood glucose. Okay, you don't want to just give them like a lick of just a little drop of orange juice or whatever it is. It's not going to do anything for the client. So that 15 grams was the important part. It has to be enough to actually equate or be more than 15 grams. So that's why 4 ounces of apple juice, which is still fine, that's still a thing. Apple juice is still going to raise the blood glucose. We just automatically went to OJ because that's almost like a trigger word. When we see hypoglycemia, usually OJ is very quickly to follow, especially something that's like around. That one made my head hurt. Don't let it. It wasn't the juice that confused you. It was the actually ounces part, okay? It needs to be 14 grams. It needs to be 15 grams, so that's why it was number 2. I know. Like I said, the rest of the options, it wasn't the fact that it wasn't sweet enough or simple carbohydrates. It just wasn't enough to provide a sufficient amount of carbohydrates. All right? So great job. That was a good one. I'm going to ask y'all this randomly, like in my stories, to see if y'all remember it and if y'all got it. So make sure y'all paying attention. All right, so that was adult health for 400, and Mary got that. Great job. All right, let's go to our next question. Let it be. Oh, y'all gonna hate me, but we're gonna do dosage calculations. Let's go ahead and do dosage calculations. Get your whatever you need out. I'm getting my calculator out because I don't have time. I'm getting my pen and my paper. Laura Allen said, I will never forget that question as long as I live. I bet you won't, because neither will I. That's another thing. When you get these questions wrong, sometimes, and especially when you go over the rationale and you're just like, oh, how did I get that question wrong? I guarantee you will not get it wrong again. Absolutely. There's a couple questions that I have like that I just feel so foolish for missing, but I promise I'll never miss it again. I'll never miss it again, period. This is one of them. All right, so like I said, we're doing dosage calculations. This one's for 200 points. All right, so I'm just giving you guys some time to go ahead and get your pens. It started at 7 p.m. Eastern Standard Time, always does. Let's go ahead and get your scrap papers out. let's go ahead and get into it, okay? All right, I'm going to read the question. This one is actually fill in the blank. It's not, it is not select all apply. I'm so sorry. This is Delta's calculations. That's usually how they do you. This one's fill in the blank. All right, so I'm going to read it. The primary healthcare provider prescribes 500, I'm going to write this down, I'm doing it. 500 milliliters of 0.9% normal saline to run over 6 hours. The drop factor is 10 drops per 1 milliliter. The nurse sets the flow rate at how many drops per minute? Fill in the blank and record your answer to the nearest whole number. Dude, you cannot have a decimal. You cannot have a fraction of a drop. That's just not how flow rates go. It's not. You have to round it to the nearest whole number, okay? Once again, I'm going to read that all over again. Just remember, you got to plug and play. The primary healthcare provider prescribes 500 milliliters of 0.9% normal saline to run over 6 hours. Now, the drop factor is 10 drops per 1 milliliter. The nurse sets the flow rate at how many drops per minute. Fill in that blank and round that thing to the nearest whole number. All right, remember your rounding rules. Remember your rounding rules. Okay. All right, so I have two answers so far. I have 2 answers so far. Let's look and see. Let me see. Actually, I have 3, 4, 5. All right, let's look and see what that answer is. All right, wait 1 second. Let me go ahead and set up. I'm going to show you guys how we're going to do this step by step. All right, let's go ahead and get into what the answer is and who got it correct first. Now, you guys know the abbreviation for drops? Put it in the comments really quick. What is the abbreviation for drops? All right, because I don't want you guys to be confused whenever you see this conversion factor. And I don't want you guys to be confused and be like, what the hell is that? Thank you, Hope Zoll, in 2020. Thank you. GTT, that is, whenever you see that, know that means drops. Okay, it don't mean got to tell. I don't know. I cannot come up with something. Got to tell, it does not mean got to tell, but it definitely means drops. Okay, so let's go ahead and see what that answer is. It is, what is 14 drops per minute? What is 14 drops per minute? Now, I'm going to show you how we're going to get that step by step, okay? 1 second. Wait for it. Wait for it. Do not laugh at my rose R falling, okay? It definitely says Oze. All right, let's go ahead and get into it, guys, so you guys can see what I'm working with. All right, so here we go. No one's looking at y'all. Okay, here we go. Wait for it. Okay, wait. Okay, all right, so this look familiar? This is our formula that's going to calculate our infusion rate. All right, so since this is our formula, all we have to do is go back to the question and plug and play. All right, the total volume. Remember, the total volume is going to be 500 milliliters. Remember, the prescriber, the provider prescribed 500 milliliters of 0.9% normal saline. I don't care if they prescribe 500 milliliters of Gatorade. The total volume is 500 milliliters, okay? So don't let that 0.9% fool you, because I know at first all those numbers was really throwing me off. But you have to know what you're looking for. Total volume, 500 milliliters. So let's go ahead and write that in. With our units, 500 milliliters times the drop factor. Now, it gave us the drop factor. It literally said the drop factor is, but sometimes it won't tell you what the drop factor is, and it'll just, it won't say, hey, this is the drop factor. It'll just give you, whatever 10 or 15 GTT per milliliter or something like that. You just got to know. That's why I wanted you guys to make sure you knew that GTT meant drop. Now, the drop factor per this question is 10 drops per 1 milliliter. Okay, so the drop factor is 10 drops. Well, per 1 milliliter. Time in minutes. All right, time in minutes. Now, right now they gave it to us in 6 hours. Now, the question is clearly asking for minutes. So we have to change and convert the 6 hours into minutes. All right. So what do we know about hours and minutes? Okay. We know that, 1 hour absolutely is 60 minutes. There we go. Sometimes I get confused on which one goes in the bottom, but that's why, honestly, it's useful to write in your units, because you know that if this is on top, then hours is going to have to be on the bottom in order for it to cancel and really, so you can remain with the minutes. All right. So once again, 6 hours, our conversion factor is that 60 minutes is equivalent to 1 hour. So we're going to go ahead and cross multiply. That's going to give us 360 minutes. So right now we have everything that we need. 500 milliliters of total volume, 10 drops per milliliter for our drop factor, and we have our correct and converted time in minutes, which is 360 minutes. So we're just going to go ahead and whip out our handy dandy calculator and figure out what that is. So 500 times 10, it's 5,000, divided by 360 equals 13.88888. All right. Now remember what I said. You cannot have a fraction of a drop. That just doesn't make no sense. So it's 13.8, but remember it said to round to the nearest whole number. That's why I said remember your rounding rules. If it's 4 or lower, round down. 5 or higher, round up. This is clearly 8, so it's 5 or higher. So we're just going to round that up to the nearest whole number, which is 14. All right, so 14 drops per minute. That is our flow rate. Great job. So the infusion is now set to run at 14 drops per minute. How was that? Did that make sense? Give me a thumbs up if that walkthrough and that step-by-step made sense as far as how to solve that dosage calculation / infusion rate problem. Give me a thumbs up if that made sense to you guys. Give me a thumbs up. Awesome job. Awesome. All right, so let's go ahead and go to, wait. I didn't pick who won. I'm silly me. All right, let's see who got 14 first. 1 second. Boop, 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 boop. First person to get 14 was Emmy Spinoza. Hey, Emmy Spinoza, you said what is 14 first? So you are on the scoreboard. I have to get my scoreboard. 1 second. All right, here we go. Our scoreboard. All right, what's your name? Emmy Spinoza. 37. You now have 200 points on the scoreboard. All right. So we have Mary SWBC in the lead with 400. And then we have Laura Allen with 300. And then Emmy with 200. Okay. Great job. All right. Now let's go ahead and go. Wait, who else got 14? NC Pink Rose, I see you. Unknown Beauty, I see that change of answer. I knew what you meant, boo. But yeah, and Unknown Beauty, Chriselle, I see you. SUX4, I see you. Dan Shelvery, I see you. Remember to put what is. All right, awesome job. All right, let's go to the next question. Ooh, peds. Don't everybody loves peds? I'm sorry, that was not a Will and Chris joke. I'm actually over this. Okay, so let's go to pediatrics. Now let's do this for 500. Let's spice them up. Let's spice it up. All right, cool. Laura Allen said, no, absolutely, let's do it. The nurse is planning discharge instructions for the mother of a child following orchiopexy, which was performed on an outpatient basis, which is a priority in the in the plan of care. Where did I come up with that word? Which is a priority in the plan of care. Once again, the nurse is planning discharge instructions for the mother of a child following orchiopexy, which was performed on an outpatient basis. Orchiopexy. That is ORCHIOPEXY. All right? Which is a priority in the plan of care. Is it 1, wound care, 2, pain control measures, 3, measurement of intake, 4, colds and heat applications? All right. We have a child that just had an orchiopexy, which is performed on an outpatient basis. What is our priority in the plan of care? 1, wound care, 2, pain control measures, 3, measurement of intake, or 4, cold and heat applications. What is our answer? What is our answer? All right, let's look and see. All right. Most of you guys are saying the same thing. All right, let's look and see what that answer is. All right, so that answer is, what is 1? What is 1? Wound care. The answer is, what is 1? Wound care. Let's see who got that first. I think I saw who it was, and it was Chriselle. Unknown Beauty, hey boo, hey, great job. You somehow came on, and 40 minutes after we started, just going ahead and just answered one question and just shot to the top. Shot straight to first place. That's how NCLEX Jeopardy is, guys. It can be literally anybody's game just because of the amount of questions and the score and the worth of the points. So Unknown Beauty has now shot into first place with 500 points. But do not fret. It can still be anybody's game. It's fine. All right. So Unknown Beauty, great job for that. 500 points to you. Let's see who else got what is 1. A lot of you guys got what is 1, so I'm about to give y'all your flowers. Okay. Everything Ari, yes ma'am. Dan Shelvery, there we go. NC Pink Rose, Angie Green, Mary SWBC, maybe 1103, 2020 DW, Hope Doll, Laura Rowland. I started this. I'm glad you found me too, boo. All right, great job. Awesome job to you guys that got what is 1. I'm proud of you. All right, let's go over the rationale, okay? The most common complications associated with orchiopexy are bleeding and infection. For 100 points, can anybody tell me what orchiopexy is? Go. You don't have to say what is. Just tell me what orchiopexy is. What's the surgery on what? Surgery involving what? What is orchiopexy? This is how we review. Okay? They may not have asked for the definition. They may have just skated by that. But we got to make sure that we comprehend every aspect of these questions, because on the actual NCLEX, they can literally, they can only ask you the same, however many questions, however many times. Okay? You can only ask our med-surg questions in so many ways. So eventually they're just going to ask you the same thing, just in different words, or just a different part of a question they're going to focus on. So whenever we get these questions, we're going to make sure we understand every aspect. Absolutely. So orchiopexy, that is surgery to move an undescended testicle into the scrotum and permanently fix it there. Some of them balls have not dropped. just like New Year's, the ball drops. For orchiopexy, it did not drop. It was not New Year's for that child, unfortunately. So we got to go in there and surgically let them balls hang low. Okay, you got to permanently bring them balls down and fix it there. All right, that is what an orchiopexy is. Surgery on an undescended testicle and scrotum. Got it? All right, so let's see who got that one first. What is putting the ball back? I can't. I cannot. I think it was Hope Zoll. Great job, Hope Zoll. So you have 100 points. Hope Zoll. Yep, great job. 100 points for answering that first. Great job, everybody else that got that. Even if you didn't get it and you didn't know it, but me asking that question prompted you to just pull up Google real quick like I had to do, because I'm not going to lie, I cannot remember what it was. But that's okay. That's why we're here at NCLEX Jeopardy, to review what we think we know and really solidify that, okay? So let me go back to our rationale. All right, so once again, the most common complication associated with orchiopexy, or them balls not dropping, are bleeding and infection. All right, discharge instructions should include demonstrating wound cleansing and dressing, as well as teaching the parents to identify the signs of infection, such as, give me the signs of infection. Give me one. Everybody give me one. Give me a sign of infection. It don't matter if you are white, black, a child, an adult, an LP, an RN, an NP. Infection's going to be infection. Give me some signs that you would teach a parent or anybody else to look out for to indicate that this patient is showing signs of an infection. Fever, absolutely. Discharge. Purulent drainage. Absolutely. Odor, discharge odor, elevated WBC, swelling. I'm looking for another one. Reddened area, thank you. Redness, what's another one? If an area is red and swollen, it's also going to be what? To the touch. What is it going to be? I'm waiting for it. Someone's going to put it. I'm just waiting to see who's going to do it first. If an area is red, absolutely. Hot, warmth, absolutely. All right. So you're going to teach that parent, that the parents of that patient, remember this is peds, and you're going to teach the parents to identify signs of infection, which include redness, warmth, swelling, drainage, fever. Sometimes, you have your early signs of infection, then you have your later signs of infection. So you want to make sure that you are letting them know kind of both, so they can see what to look out for. By the time somebody has a fever, that infection is pretty much in there, okay? You don't want them to be septic. So yes, warm to touch. Those are the early signs of an infection, all right? Back to the rationale. Testicles will be held in a position to prevent movement, and great care should be taken to prevent contamination. Okay, good. We're back. Hold on. Let me put my phone on charger. Nope, not that one. Okay, wait for it. Okay, great. Yes. Prevent contamination of the suture line. Absolutely. Analgesics may be prescribed, but are not the priority, considering the options prevented. Pain control is important, but between preventing infection and that pain control, which one's going to kill the patient first? The infection. They're going to be uncomfortable with the pain, but we're always going to attend to, for as far as priority, because remember, you see that word priority? That literally, whenever you see that word priority, that means make sure that whatever you're doing is preventing, you're attending to something that's, if you don't, it can probably lead to harm or even worse for that patient. All right, so once again, analgesics and pain relief is important, but in this case, not priority, okay? Measurements of intake is not necessary, all right? And then cold and heat application, that is not a prescribed treatment measure, okay? Cold and heat applications. This isn't a pulled muscle, okay? All right, so once again, the answer is what is one? Wound care, because you're trying to prevent infection, which can lead to harm of the patient if that occurs, okay? So great job. Awesome. Oh, thank you. Awesome. Yes, LPN is life, honey. Do you have physical copies of study guides? So all my study guides are available digitally, but they are printable, just like any other like digital download PDF. You can print it by yourself, personally, at home, at school, whatever. But it is a 400-page download if you do the ultimate bundle. If you get like a lesser page download, you can just print it however you want. Or you can print it professionally with Print Me One. If whenever you purchase the digital product, you get a 10% off code for the professional printing if that's what you want. Print Me One is the one that's the one that you probably see. Like this one. This was printed with Print Me One, and so was the Ultimate Bundle. Okay, they laminate it, bind it, and deliver it to you, depending on what option you get. So yes, they are all available digitally, but in order for you to print it, you have to get the digital version first. There is no getting it just the printed version. You have to somehow acquire the the digital version first, whether that is through buying it, purchasing it, or winning it through NCLEX Jeopardy or Tease Tuesday, whatever the case, or a giveaway. So great job. Let's look and see. Thank you. It is lifetime. Once you purchase it digitally, it is a lifetime purchase. All right, let's go to the next question. I think we have to do fundamentals. Let's do ooh, that's a good one. Let's do fundamentals for 300. Fundamentals for 300. Thank you, love. All right. Fundamentals for 300. The nurse is reviewing the laboratory test results for a client with a diagnosis of severe dehydration. The nurse should expect the hematocrit level for this client to be noted at what level? Is it 1, 60%, 2, 47%, 3, 45%, or 4, 32%? Run that back. All right. The nurse is reviewing the laboratory test results for a client with a diagnosis of severe dehydration. The nurse should expect the hematocrit level to be noted at which level? 1, 60%, 2, 47%, 3, 45%, or 4, 32%. What is our answer? Okay, not everybody giving me the same thing now. Okay. Oh, except for Blackbird. That's okay. Majority of everybody, that's fine. It's totally fine. All right. Okay. I'm getting majority ones. I'm getting some getting a 4 here and there, a 3 here and there, but let's go ahead and figure out what our answer is, okay? All right, so our answer, remember, we have a patient that has severe dehydration. How is that going to affect the hematocrit level? This is a great question that you're going 3 for 5. Laura Allen, absolutely not. All right, let's go ahead and figure this one out. All right, so the correct answer is what is 1 60%? What is 1 60%? Who got that first? I saw. And then I forgot who it was. Bentaquib. Hey, Bentaquib. Wait, go to my thing. All right, so Bent _ a cube. All right, you're on the scoreboard with 300 points. Great job. Who else got what is 1? A lot of you got what is 1. So once again, let's go ahead and give y'all flowers. Great job. Unknown Beauty, Dan Shell Valerie, Carter with the CBD, SUX4, Eye Candy, One Unique Gemini, Mary SWBC. We said Carter already. Denisita, No, not you. Wait. I'm not dealing with you, Laura Allen, with your multiple answers. But yes, the answer is what is 60%. Now let's go into why that is 60%. All right. Normal hematocrit level. Is it going to be the same or different for male and female? Is it going to be is the hematocrit level of a male the same as the hematocrit level of a female? Yes or no? Yes or no? Who's going to answer it first? Absolutely, Laura Allen. The hematocrit for a male is different than that of a female. And in what way? Who's going to be higher, male or female? Who's going to run higher naturally, biologically? Whose hematocrit is going to be higher, a male's or a female's? Male, absolutely. Thank you, 2020 DW. Awesome job. So the normal hematocrit level, mind you, these normal levels, they may or may not differ by like a percentage or two, depending on whatever textbook you're using, whatever publicator lab that they use. Sometimes the values will differ very slightly, okay? Very slightly. All right, so here it says the normal hematocrit level is approximately 42% to 52% in a male and 37 to 47% in a female. All right. Now, hematocrit that is used and is measured as a proportion of red blood cells or RBCs to the volume of blood. Okay. And it's and a decrease in fluids that make up the blood can cause an increase in hematocrit level. All right. So once again, if you have that drop in fluids that make up the blood, the hematocrit will go high. All right. So the more dehydrated you are, the higher the hematocrit will go. All right. In a client with dehydration, the nurse would once again expect to note an increased hematocrit level. Kind of think of that as like an inverse relationship. All right. Fluid content, water content drops, aka dehydration, hematocrit goes up. All right. Conversely, all right, an increase in fluid overload, that would cause a decrease in hematocrit level. So it's almost like that increase in fluid is diluting the blood, which will make that hematocrit level less concentrated, which will decrease the hematocrit. And the opposite, like I said, conversely, the opposite effect is the same thing with dehydration. Okay. That makes sense. Boop, 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 boop. See, that exactly. The one says 38%, 55%. Nah. All right. So yes, once again, severe dehydration. Now the answer choice is that 47%. In the actual problem, it doesn't list whether or not that patient is male or female. But looking at the answer choices, at 60%, which was the correct answer, 2 was 47%. That's not going to be the answer, because once again, our levels are 42 to 52% or 37 to 47, and 47 is within both of those parameters. Same thing with 45. 45 is within both of those parameters, and 32 is lower than those parameters. But remember, 32%, that is a low hematocrit level. And remember, if you have a low hematocrit, then that means the fluid level should be high. All right, because remember, there's an inverse relationship between hematocrit level and fluid level. So if hematocrit level is lower than 37%, then expect for that fluid level to be high. If the fluid level, if that hematocrit is higher than 52%, in which case this would be 60, high hematocrit, remember the opposite of high is low fluid, so severe dehydration. That is going to be our answer. Does that make sense? Whoop, whoop, whoop. Yay! Thank you, Laura Allen. It says, I honestly forgot, shake my head. I really appreciate these reviews so much. I'm rocking it even after my NCLEX. Listen, I have registered nurses that are actively working in someone's ICU, ER, whatever, that still come to NCLEX Jeopardy just for the review. Because at the end of the day, facts are facts. That's why I keep trying to stress. Facts are going to be facts no matter your credential, no matter where you are. You're going to, there's no harm in reviewing or refreshing everything because you will not remember everything you learned in nursing school. You won't. You just won't. And that's fine. I wouldn't even want to remember all that stuff. Okay? Let's see what else you guys are saying. Perfect. Okay. Let's do, right, we're forever learning. All right, we just did, one second. All right, let's do one more question. Let's do a 500er. A 500, no fair. What's no fair? All right, let's do a 500er just so we can kind of shake things up. Nope, not that one. I feel like yep, this one. All right, this one is adult health for 500. This is going to be our last question, guys. Our last question. Quick little review of the scoreboard though, so you'll know where to go. So you know who's winning. Unknown Beauty, lead was 500, and then you have Mary SWBC, and then you have Laura Allen and Benta Kib tied for 300 points. Wait, yeah, and then Emmy Spinoza for 200, and then Hope Zoll for 100. There's everybody on the scoreboard right now. Okay, all right. So this is the question. A client is complaining of low back pain that radiates down the left posterior thigh. The nurse should ask the client if the pain is worsened or aggravated by which factor. So 1, bed rest. 2, ibuprofen. 3, bending or lifting. Or 4, application of heat. What is going to be our answer? A client is complaining of low back pain that radiates down the left posterior thigh. The nurse should ask the client if the pain is worsened or aggravated by which factor. 1, bed rest. 2, ibuprofen. 3, bending or lifting. Or 4, application of heat. What is our answer? Ooh, not a lot of you guys are choosing the same answer, which is 3. So let's go ahead and look and see what the answer is. The answer is what is 2. I'm just kidding. It's what is 3. It's what is 3. I'm just kidding. Y'all would have been mad. Y'all would have been mad. I know, me too. All right. So the answer once again is what is 3, guys. Bending or lifting. First person to get that on my screen and answer that correctly was 2020 DW. Congratulations, boo. All right, so you are on the scoreboard with 500 points and tied with Unknown Beauty. Great job, great job. All right, who else got what is 3? Like I said, a lot of y'all, we're going to give you your flowers, okay? Everybody loves to point out when someone's wrong, but we don't get enough praise and recognition when we get a question correct. Okay, we don't do that over here with Nurse Sam or even the study bar community. Okay, we're celebrating wins, we're celebrating losses because at the end of the day, it's making us better students, which will make us better nurses when we go ahead and pass that NCLEX. Okay, period. All right, so who else got what is 3? Hope Zoll, I see you, boo. Great job. Unknown Beauty, Laura Allen, Mary SWBC, One Unique Gemini, Angie Green, who else? Carter with the CBD. Wait, now, Laura Allen, why did you just change it to 2? You said 3. Don't change your answers. Do I have to put that, do I have to repost that post about not changing your answers, young lady? Alex, I see you. Where else? All right, great job. Great job to everybody that got what is 3, bending or lifting. Let's get into the rationale, okay? It says low back pain that radiates into one leg, which is called sciatica, by the way, that's consistent with a herniated lumbar disc, okay? The nurse assesses the client to see whether the pain is aggravated by events that increase intraspinal pressure, such as bending, lifting, sneezing, coughing, or by lifting the leg straight up while supine. Remember, straight leg raising test, that's what it's called. Bed rest, heat, or sometimes even ice, and non-steroidal anti-inflammatory drugs, aka NSAIDs. All those usually relieve back pain. All right, that's not going to worsen or aggravate the back pain. So that was kind of a trick easy question because all the other factors actually doesn't aggravate or worsen the low back pain. It actually helps alleviate. So I see what they did there. So yes, the answer once again is what is 3, bending or lifting. And why? Because those certain events, those increase intraspinal pressure. And if we have a herniated lumbar disc, and fun fact, my first job out of LPN school, I was actually, first of all, the ad said LPN or RN, and guess who came and stole the job? Not stole, but guess who came and won the job over however many RNs and other LPNs that they interviewed for? I guess it was me. But yes, I worked for a private practice spine center here in Atlanta, and we saw herniated lumbar disc all the time. And what I loved about working there was just the way he would explain things. He actually explained herniated lumbar disc as like a jelly donut. Think about the lumbar disc as a jelly donut, and whenever that is herniated, some of that jelly is squirting out. And that jelly is actually putting pressure on the nerve, kind of like a game of, what's that game called? Operation. Almost said surgery. Yes, that game of Operation. But yes, with that jelly donut, whenever too much pressure is applied to that disc, okay, it can herniate, which means that jelly in that jelly donut is squirting out. That Dunkin' Donuts, raspberry jelly donut, whatever, it's going to be squirted out, and that jelly is going to be putting pressure on that nerve, and that is how you get sciatica. Okay, so what you want to do to assess whether or not you have a herniated disc is to pretty much reinvent the pressure that's making that disc herniate, but try not to make it worse, but just you're just reinventing and you're redoing the event that's actually going to increase the intraspinal pressure, all right, that's going to squeeze some of that jelly out, all right? And those things include bending. Now just think about bending, all right? Pretend this is your spine and your discs. If you are bending like that, all right, imagine you are bending a donut. That jelly is flying. Okay. Same thing with lifting. You're compressing that jelly donut. That jelly is going out. Sneezing, coughing, same thing, but just not as intense as bending and coughing. Bending and lifting, but still increasing the intraspinal pressure. It's almost the same way it would intracranial pressure. Remember, that coughing increases intracranial pressure, but it does the same thing with your intraspinal pressure, okay? Did that make sense? Did that jelly donut analogy make sense? I would never look at donuts the same. Okay, don't make me do a study kit about some donuts. Is that what I have to do? Is that what I have to do? Don't make me do a Dunkin' Donuts pink, orange and white lumbar jelly donut. Don't make me do it. If you want me to do it, give me a thumbs up in the comments, because that actually sounds really fucking fun. Let me know. Let me actually write that down, because it really sounds fun. Okay, cool. I'll add that to the queue. Okay. Let me go back in it to see what you guys are saying. Say yes. Say yes. Absolutely. Period. Not for hypotheticals. That's funny. All right. Okay, guys. So that just concluded our last question. All right. So our 2 winners. All right, so our first place winners, we have a tie with the 2020 DW and Unknown Beauty. Both of them have 500 points. So congratulations. Do a Hershey's Springs one. And that's funny. That's funny. I should do one. I kind of did like a tweet thing on it, but I should really do like an actual like cheat sheet on that. I'll put that in the queue as well. All right, so once again, congratulations, 2020 DW and Unknown Beauty. Unknown Beauty, you already know what it is. Love, you already know what to do. 2020 DW, please DM me your full name, your email address, and whether or not you have the Ultimate Nursing School Bundle, because you just won a free copy of the 400-page Ultimate Nursing School Bundle, which normally runs you about $97 regularly without no discount code or anything like that. So congratulations. It is about like a $2.99 value. It is 400 pages, y'all. It is 400 pages of information. This is a 5-star product. Read the reviews, okay? So congratulations, 2020 DW. You just got a free copy. All right. Once again, please DM me your full name and your email address, and I will go ahead and get that over to you. Chriselle, did you get your sweater? Let me know if you got your sweater. Let me know if you got your sweater. All right. Our next winner is going to be Mary SWBC. Congratulations, love. You had 400 points, so you came next. You are third on our list. So Mary SWBC, same thing to you. If you do not have the Ultimate Nursing School Bundle, congratulations, you just won it. If you do, then you can get just another kit that you don't have, which would be if you have the Ultimate Nursing School Bundle, the kits that are not included in the Ultimate Nursing School Bundle include the Critical Care Study Kit, so you can get you can get that if you would like. And it also doesn't include the NCLEX Arcade workbook. Now that is 372 pages, and it accompanies the 6-day review video. However, just the workbook is going to be what's sold on the shop the Nurse Sam shop. If you want the full thing, the workbook and the 6 videos, you would have to get that for $97 in a link in my bio. Okay, it's going to be the full NCLEX Arcade. Or also, if you want access to the NCLEX Arcade without having to spend $97, you can actually just subscribe to and enroll in the study bar community, because that is actually a bonus. How about that? And that's just $29.99 a month versus you paying $97 for that product. So there you guys go. All right, so once again, congratulations, 2020 DW, Unknown Beauty, and Mary SWBC. Name, email, and just confirm that you're getting the Ultimate Nursing School Bundle, because that is what you just won. All right, congratulations, everybody. Now, everybody that's here, do not leave yet. I'm telling y'all this now. Tomorrow is April Fool's. Tomorrow's April Fool's, and y'all know I got to do something, not because y'all are fools, just because this year has been very foolish, okay? Especially within the nursing community. So I just wanted to do something nice for all my nursing students. I highly, highly, highly suggest that you download the free Nurse Sam app. Do it now. Do it before tomorrow. Do it before tomorrow at noon. I'm going to say it one more time. I highly, highly, highly suggest you download the free Nurse Sam app. the Nurse Sam. White background, gold and black Nurse Sam on it. It is free to download for iOS and Android. I highly, I'm not going to tell you what happens because you'll find out tomorrow, okay? But you'll only find out if you have this app. I'm going to tell you. I highly suggest that you download this app, because if you don't, you can find out about it on Instagram and you're going to be mad. You're going to be mad. So click the link in my bio. Danicita, where can I subscribe? You click the link in my bio. It says join the monthly membership. That's where you can subscribe and enroll into the study bar community. Also, don't forget, we have our virtual launch party for the study bar community on Saturday. That's also free and open to you guys. Before we were RSVP. We're still RSVPing, but we can now have more than 300 people. So I opened the doors back up for you guys to get tickets. Once again, it's free. We're going to play games, have giveaways, give a tour of the study bar community, the membership, and tell you guys of all the great things that you're going to get when you become members. But yes, as far as tomorrow goes, I highly suggest, especially if you are waiting or have been waiting to purchase anything from my site, especially any digital products, I'm going to say it one more time. I highly suggest that you, I'm going to eat my study gummies. Amen. Y'all see that? Support and focus, memory, and mental clarity. I had to pop me one real quick. Okay, so once again, I highly suggest you download the Nurse Sam app so that you are not left behind in tomorrow's awesomeness. Just download it before noon tomorrow. Go ahead and download it right now. That's all I'm asking y'all, so you don't feel left behind, and so you don't miss out on this amazing blank that I got coming up tomorrow. That's all I'm going to say. Okay. Can you briefly talk about the study bar? Listen, sure. All right. So the study bar community, that is our new monthly membership for nursing students. All right. You can go to studybarcommunity.com. You can read a list of everything that we have going on there. But just a quick little review of what we have. You can also come to the virtual launch party. We're going to go over it there as well. But just to give you guys a quick little tidbit, once again, this is for my nursing students. It's a monthly membership. You're going to, when you sign up for $29.99 a month, and that's our special introductory price, that thing will go up. It will go up. So I just want to make sure you guys getting it in at the low price. And when you do get in with that $29.99, it will be grandfathered in. You won't have to worry about when we do increase the price, your price won't increase because you came in at that special rate. It'll be locked in for you. All right, so when you do enroll, you'll get access to literally every study kit that I have, whether or not it's available on my shop or just exclusively to the study bar community. That's what happens when you become a member. You also get access to the Ultimate Nursing School Bundle and all the study kits within that, all the cheat sheets. You have access to our video vault that contains all the ATITs, Tuesday replays, NCLEX Jeopardy replays, tutoring videos from Nurse J, upcoming VR videos, metaverse. That's all I'm going to say. Summer is going to be hot, okay, especially for the study bar community, because that's where all our VR videos are going, and our metaverse videos. Hey, you also get monthly live Q&As with some of your favorite nurse professionals, experts, and business experts as well. We get monthly group tutoring. A lot of you guys kept asking me about, like, do you do tutoring? We do. Inside the study bar community only. It'll be monthly. It'll be like a group virtual study party. My study parties have always been the best, even from when I was in nursing school, okay? We would just order pizza. We would just, whether it was physical or literally virtual, and we'd just be on the phone or whatever, or like on FaceTime or whatever. Most likely we were in person, but we're going to be doing it virtually. Listen, we always called it a virtual study party. Because it helped with motivation. Nobody liked, it just really helped make it fun. We would play games. We would sing to each other. We would make songs, and we would take turns teaching the other person content that the other person comprehended, but maybe the next person didn't. You'll also join our community where you can just meet and network with other nursing students. Find your accountability partner. Find your study buddy. And then you also get access to the members only app. So you have access to this community both inside the app, which is free for members. The app is free, period, but there's no point in downloading it if you're not a member, because it's going to be blank. You won't be able to see anything. So just download the Study Bar Community app if you're actually a paid member. Once again, it's $29.99 per month for right now. What else? Oh, some other things that you guys are definitely going to want to know. A lot of people were asking for the digital version. The digital version of the Nurse Life Planner. This is the Nurse Life Planner that we have now. It is physical. It is $49.99, but a lot of people were asking for the digital version. And and that's available, but only available and exclusively to the members of the Study Bar community. It is free, and once you guys download, you guys can literally download that thing immediately. As soon as you guys as soon as you guys enroll, you guys have access to everything that I just described, the exclusive digital planner. All right, so it's not just the PDF, it's actually the interactive planner, digital planner. You can press on the tabs. It's very interactive, especially plus it's tabbed. Okay. And you also have access to NCLEX Arcade videos and workbook. Amen. All right. And that's just a little bit about the Study Bar community. We're also going to talk about it more and give you guys a virtual tour of the community on Saturday during the virtual launch party. So make sure you guys come to that. But once again, if you just want to go ahead and get into access, it's $29.99 per month. You really can't beat that. You get so much value for only $29.99 per month. But that just lets you guys know that I am just fully committed to making sure you guys have an amazing nursing school experience. I know mine was just riddled with anxiety and just depression, and it was not fun for me. So that's why I want to make sure that you guys have a different experience. Take control of your nursing school journey. Don't let outside factors or anybody else, make you feel like you're in the wrong program, make you feel like you're, getting the wrong credentials, make you feel like, what you're studying, you're not good enough, and that your grades aren't good enough. Absolutely not. We're taking the pressure off and adding the fun and the joy back into nursing school. Okay, because honestly, it starts there. If you have a great time in nursing school and a great experience in nursing school, that's going to carry over into your career as a nurse. So I fully and wholeheartedly believe that. That's why I'm so dedicated to making sure you guys have a great, fun, creative experience. That's why I make my study guides the way I make them. That's why we have these fun NCLEX Jeopardy reviews, these fun ATITs reviews, just to help increase motivation to make you actually, want to be a nurse, especially amidst everything that's going on in the world. Okay. So once again, make sure you guys check that out and download the NurseSam app, the free NurseSam app before tomorrow. Okay. All right. If y'all have any other questions, send me a DM. Make sure it's a question. Well, I'm not gonna say that. Send me a DM, and I think that should be it. I will see y'all. I'll catch y'all on the flip side. Are y'all following me on TikTok? Make sure you do. All right, y'all. I will see y'all next time. Congratulations to all my winners. Remember to DM me your name and email addresses, and I will send that right over. All right. You guys have a wonderful night, and I will see y'all on the gram.